Hello and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And today I'm chatting with Dr. Mariana Colmenares Castaño. Welcome, Mariana. It's good to have you back here at Gold.
Hi, I'm really happy to be here with you as well. Thank you.
So you are going to be part of the Gold Lactation Online Conference of 2025. That's just around the corner, really. We'll get started in just a couple of weeks, I believe. And your presentation title, I really find very interesting. It's titled Clinical Case Studies When Tongue Tie Release is Not the Whole Solution. So I want to talk to you about that in just a moment. But first, a little bit about you. You are an pediatrician and an IBCLC. So just give us just very briefly a little overview and then a question I'm personally very interested in. Do you do any tongue tie divisions or revisions?
Well, yes, I'm a tongue tie practitioner actually. As a doctor, I always liked to do hands-on things. It was one of my favorite things to do in the hospital, even before during my training and in my life. So after I became an IBCLC and I learned about tongue ties, which is was when once I was an IBCLC, I didn't know about tongue ties when I was a pediatrician, and that's like really scary. I think no, they never teach us about this kind of issues, and when I learned about it, it was like my mind blew, and it was like, wow, this is a way we can treat children and some of the issues. And I'm sure that many of them, I didn't see them in the past, which was like difficult not to understand. Mhm.
And pretty eye-opening, I imagine, right?
Yes,
Once you learn about it, you can't unsee it and unlearn it. And um,
exactly.
what have you seen in your practice? We hear a lot about tongue tie. Is there really an increase in procedures, or do you think it's more like we have more procedures because we have more education now, or is it just because we talk about the topic more? Just tell me a little what you've seen in your area.
I think it's difficult to understand. There has been an increase, definitely, but also there has been an increase in the sensibility about the topic. So it's something that people are much more interested in, and people are talking much more about it. I think that parents are also seeking more attention about breastfeeding issues. So when we see more parents looking for that, it's obvious that we will see more tongue ties because more
Mm.
parents are looking for support, and then there are tongue ties. But also, I think that it's not always the problem, and that
And
sometimes
yeah,
when you
go
have
ahead, go ahead.
that situation when they tell you it's a tongue tie, and it has happened to me a lot of times that they refer me patients as a tongue tie practitioner, and then I see the baby and it doesn't have a tongue tie. It's like
Mm.
once the parents think that it's a tongue tie and that the release will be like everything, and then when you tell them that it's not the problem, it becomes much more difficult. Sometimes I prefer it to be a tongue tie. It's like, it's going to be much easier to understand and to solve.
So do you think then parents are getting disappointed because they're hoping, oh, if we just do a quick, procedure, then everything is better? So is that what you're experiencing there? You're seeing there?
Definitely.
Mm-hmm.
Definitely. Parents, usually the journeys of parents that you are not the first person that they see, usually is because they have been looking at other situations and maybe more than one lactation consultant or maybe more than one healthcare professional, that it's sometimes not solving the problem or sometimes not getting to the real problem. And then I think that sometimes tongue tie is like the diagnosis that will pop,
Mm-hmm.
and then, oh, it's a tongue tie. No, and then let's fix it. And then it isn't. And yeah, I think that
Yeah,
that's an issue. Mhm.
that is an issue. Would you say that is one of the most common misconception about tongue tie and its role for breastfeeding difficulties, or what other misconceptions do you see about tongue tie?
Usually, what I think is that, well, what I see is that they feel that the tongue tie division will solve the problem,
Mm-hmm.
all the problem, without really looking at breastfeeding as a whole thing. Or like it matters not just because of the baby's tongue, and it matters because it's the mom and a breast and a milk supply and a baby and a muscle tone and other abilities. So there are many, many other things. So it's much more complex than just that. And I think that when they think as a little bit of it, then you may be missing many of the picture, a lot of the picture.
Absolutely. Well, thank you for clarifying that. And also, I have what would you say to an IBCLC? Let's say they have a case like what you described, the parents come in thinking, oh, I have a tongue tie, maybe because I read about it online, or, maybe somebody else had told them about it. They come to you and you're looking at this going, no, that's not really, and you see the disappointment setting in. What kind of tip can you give to an IBCLC who is in that situation? Now, of course, every situation is different, but like, what kind of strategies have worked for you in this case?
I think that the multidisciplinary work, it's the most important part of it. I think that I have to work with like incredible IBCLCs locally, and then you can have this assessment that we can all do our part, but then don't missing those other things that needs to be supported as well. So I think that when you have a team, when you can work together with other people that may know more things about certain areas, milk supply or pumping or things like that, I think that the result at the end is much, much better than if you just work with one. And I think that happens in everything around health. You have to be much more realistic. You have to look at all the picture, not just a division of something.
Absolutely. I love what you just said there about, building kind of finding other care providers, and if, so you can provide resources and maybe also brainstorm or meet or maybe to offer this kind of holistic, overall approach. And that is also something the parents might feel more comfortable in, because then they feel like they're looking at the whole picture and not just like one issue at a time, for sure. Yeah, absolutely. Now let's talk about your presentation, clinical case studies when tongue tie release is not the whole solution. So you're actually going to be presenting cases for us in the presentation, correct?
Yes, and this kind of cases that like the first step is not just dividing a tongue, is usually a bit more complex, or when there isn't even a tongue tie, and you need to like assess other things. So yes, the cases are going to be a bit more complex, maybe. That's always something, that the complexity comes when you're not just looking at one thing. We know that positioning and attachment is like incredible, like it solves a lot of the problems, and just solving a bit of the technique about the angle of the baby, the way mom is, I don't know, carrying the baby or position or whatever. And when that solves the problem, it's like you breathe. It's like, okay, but then you do that and it doesn't help. And then there's still some pain, there's still some issues around that. And as a pediatrician, I think that what I sometimes see is these babies that are not like, the problem is not getting better, just thinking about the thing, like looking about maybe weight gain, or looking about the muscle tone, or even neurological issues with babies. So I think it can become much more complex once you see more children, obviously, more babies. You will get this ones that are a bit more complex. You need to look further.
I can really see the passion in your voice, and see how you, in your demeanor is like, this is something you really actually so passionate about, and you really love, working with families and solving those more complex cases. And that's the knowledge you're going to share here with us at Gold for this presentation. Wonderful.
Yes.
So, Mariana, before I let you go, any final wise words for our viewers here?
Well, definitely looking at the big picture. That will be my recommendation. Let's focus, like get back, and see everything that can be affecting a baby. And I think that that's always very helpful. And having a multidisciplinary team, that's another thing that I think it's super important.
Well, thank you so much, Mariana, that you are here with me talking about the wonderful work you're doing, and also the presentation here at Gold. It was a pleasure having you here today.
Thank you, and can't wait.
And now some information for our viewers. I know now you want to see that presentation, clinical case studies when tongue tie release is not the whole solution. That is part of our live conference here, our Gold Lactation online conference. We're getting started. It's just around the corner. All our presentations are, of course, live and recorded, so you can watch them at your leisure. And we have keynotes presentation coming up. They are absolutely open access, so make sure you sign up for those as well. You'll find more information at goldlactation.com, and I hope to see everyone at the conference. Thank you all for watching. Bye-bye, everyone.